good morning. So I'm gonna perform a total scenarios. So I also got called from the ER. So once I'm about to arrive to the ER, I always have to check the chart, and then I have to immediately, after checking the chart, go to the patient, do my set of vital signs, make sure I auscultate them, check the SpO2 level, even the labs if I'm going to check it from the patient chart, and also the ID band. And also I always make sure to introduce myself and what's the purpose that I'm going to do there, such as telling them, good morning Mr. Phillips, so my name is Anthony, so I'm here as a respiratory care student from the respiratory department. So the doctor would want you to be put up a simple mask just to help with your breathing, and then it's gonna be set up at about 8 liters. So first is have to fill it with our hands if there's air or flow coming out, and then make sure this is no longer kinked with the tubing. Try to loosen it first before putting it to the patient to avoid from any uncomfortable the patient feel. Make sure that it's being secured when putting up to the patient's face, and then make sure, especially with this for the nose. And then before leaving to the patient, do a set of vital signs, and then make sure we chart it to the patient's chart. And then after after 3 days, I was doing my rounds to the patient who was already being admitted to the room, and then the patient is still at simple mask, and then I observed the SpO2 of the patients being consistently at 99%. So it's been more than 3 days or 3 days already. So the doctor would like the patient to be weaned with this simple mask just to prevent from any CO2 retention. So I immediately try to recommend to the physician that if they want the patient to be weaned off, we have to gradually try not to suddenly wean the patient from the oxygen. So I immediately recommended it to just put it on nasal cannula, such as putting on a flow of 5 liters. With a simple mask, we have to put it on the clean container, and then put it on the patient's bedside just in case if they want to use it or if the patient's condition would deteriorate. And then with the nasal cannula, I set it at 5 liters for the patient to be weaned off. So we have to fill it with our fingers, and then try to tell the patient that they are been trying to wean off. So this is air coming in to their patients, to their nose. Make sure we hook it up with their nose. And then after hooking this to the patient, because it's being set at 5 liters, we have to try to observe the patient for about a couple of minutes, or just maybe about 20 to 30 minutes. Try to observe if they were able to tolerate. Because I sense the patient was able to tolerate, so we try to decrease the flow about 4 liters, and then maybe about after again a set of few minutes with the SpO2 level, we can also try to obtain an ABG just to observe if the patient was able to ABG levels was normal after switching from one device to another. If the ABG levels or the result was kind of normal, we can also try to decrease until such time that the flows be to the lowest level, and then the patient can be weaned off. So assuming the patient's being weaned off by the oxygen, the nasal cannula should also be put up in the safety clean container, and then should be at the bedside. And then try to observe the patient, do another set of vital signs, and then we have to communicate with the physician that the patient was doing well, and then make sure we chart everything, what our observation is, and then make sure we wash our hands, and we're good.